Welcome to the Talking HealthTech podcast. My name is Peter Birch. Today on the show, we're at HIC 2025 in Melbourne, and I'm joined by Claire Holt, Technical Health Information Manager at Austin Health, over here at the Data Capture Experts booth. G'day, Claire. How you going?
I'm great, Peter. How are you?
Super good. It's great to be here and taking up some space on the expo floor at HIC, but to really dive in and learn a little bit more about Austin Health, but also the work you're doing with Data Capture Experts. So for those unfamiliar with you, tell us a bit more about you and your role, but also Austin Health as well.
Yeah, so Austin Health is a major Melbourne tertiary hospital. We've got 3 campuses. We've got rehab, we've got the Heidelberg Repatriation Hospital, and we've also got the main campus. So we do everything from liver transplants to all the community health sectors, day surgery, all that sort of thing, and including being the state-based rehabilitation centre.
Got it. And so your role at Austin Health?
My role, so I'm a health information manager by profession, and I've got the technical added to the front because I've got a significant background in digital health, so I tend to be that sort of in-between person between IT, the business, health information, data reporting, all that sort of side of thing.
And for those unfamiliar with the health information management side of things, because some might kind of bundle up the technical with it as well too and figure this is your jam. I'd love to get your take on the role that it plays in connecting all the bits.
Oh, absolutely. So we can collect as much data as we need to, but there are legislations, governance, all that sort of stuff in place where we shouldn't be collecting things that we don't need. Absolutely. But we also need to be able to use what we do collect. And some of what we do collect needs to be mandatory reporting to government, all that sort of thing. And it's actually about making sure that that collection process flows with what the clinicians are doing. So it's not a burden, that it becomes part of the workflow. Yeah.
And so tell me a bit about, I guess, the approach at Austin Health in terms of plugging some of those gaps and the role that technology plays in delivering care on a day-to-day to lead us into this conversation. Anyway.
Absolutely. So this is the loaded question. So it was interesting this morning, Norman Swan mentioned about the burden of legacy systems and all that sort of thing. So the Austin Health's environment, we've had a major EMR for 15 years. We've had a PAS system for 20 odd years. We've got at last count, about 200 slightly different clinical systems that all have to talk to each other. So part of the journey that we went on, particularly with starting this journey with Data Capture Experts, was we had to really validate the value of implementing another system into this environment. It was a tough call, but it was part of that whole procurement process and everything in terms of how we did that.
Well, I guess, technology doesn't get implemented unless there's a problem to solve. I'd love to start to unpack that a little bit about, what problem you're trying to address in the first place.
Yeah. So the problem we were trying to solve, we had a legacy piece of software that was coming to end of life, was no longer going to be supported. So we had a very strict timeline as to when that wasn't going to be supported anymore. It accounted for nearly, about 120,000 client contacts per year in our community health space. And essentially when this software stopped working, we had no way of reporting it. So we needed to replace that. It was also an old piece of software. So when we came to look at what we could replace it with, suddenly technology's moved on so much further. So we could get a lot more functionality out of it, which was great. But then, of course, when they said, you get all this functionality out of it, can you do community mental health as well? And we went, yeah, sure, quick look down all the requirements that were needed, and we managed to get that in as well. What we didn't scope at the beginning with that, though, was the amount of work required just to add on community mental health.
Interesting.
That's when we discovered there's over 600 staff in that area, so it was a big call.
Yeah, okay. And how does it fit in with the overall kind of tech cycle? What's the work happening within Data Capture Experts that you're utilising?
Okay. So the main part that we're using is the administrative functions of managing community health episodes. So it's things like referrals in. There's a number of data elements that need to be reported to the Victorian government for that. But it's also then the booking of the work in terms of booking the appointments, booking the telehealth calls, booking all that sort of thing. But then it's also being able to close it out to report, but it's also being able to get schedules and do groups and all that sort of thing, and keep track of all that work.
Yeah.
In the community mental health space, it's again being able to get all the referrals in the one space. What we discovered with community mental health was they were still operating off Outlook calendars and Excel spreadsheets.
Wow.
So there was a big a big push there to get them all onto one system so that we could see what we were doing, see the activity, really.
Yeah. And so I'd love to learn a bit more, because being an implementation guy myself, and there's one thing where you look at maybe a presentation or like this is or the vision of like the end product, and you kind of look at your state that you're in now, and you mentioned it was almost like a leapfrog of well, how much the technology has moved on. I love to just hear the stories around what does implementation look like, because that's where the rubber hits the road, and we talk about all of that, and we talk about let's engage all the stakeholders, and you've got to make sure the change manager's done well. But sometimes in the heat of the rollout, it's you can have the best plans, but everything's on fire.
Yeah. So first things first, we had a really aggressive timeline for implementation. We needed to get from the time data capture experts walked in the door to being live with the community health part, which is the part that we had to do the mandatory health reporting for. We had 4 months and we did it, which was amazing. But I'd probably say of that 4 months, 2 months was the engaging with the business, working through the business processes and all that sort of thing, just to get the bare bones of what the business needed to be. But then once we actually had the platform in, that was the beauty of it. It became really quick and obvious as we were training it out to the users who were going to use it. Very, very quickly they moved from, which button do I click, to, hey, this impacts my workflow this way. How can we improve the workflow? Which spoke volumes about the software, because it was just a case of, great, you've given me a tool I can use. Let's use it. Let's use it in the best way possible, which was a huge leap, because previously what they'd done was retrospective data entry. It did nothing about managing the workflows or the care or anything like that. So that was the big leap.
I often think about this, when you put existing workflow versus technology, and how much the technology needs to mold around the existing workflow versus how much the moving into a new environment. Because sometimes people say, if you have to adapt to suit the technology, that's not good, because the technology should adapt to suit us. But I often think about sometimes when you've got a good, like if you do things the way it's designed to do, then that's when you start to get some of the efficiencies. And I'm sure there's nuances and variances there, but
absolutely. There is this grey area between taking what the software can do, taking what the workflow is, and working out what happens in the middle. And that's really where health information managers are important in these projects, because that's what we do in terms of we can see the data elements that need to come out, but we can also see what the workflow needs to be. And so it's around adapting, but it's also that negotiating, going, hey, if you click this first, you're saving all this time at the end of the month where you don't have to sit there for 3 days and do your data. If you just click these 3 boxes, you're done. And being able to sell the benefits and show why it makes a clinician's life easier. And that's the key. If you're not making their life easier, what the hell are you doing?
Yeah. And was it a big bang, turn everything off and turn everything on and use all the features, or how was that approach? But
we did for community health, where we basically said, right, from the last week of June 2024, you have to start entering all your appointments in this system, all that sort of thing. We do have a nice little bit of a leeway, though, between sort of end of June, July to middle of August. We've got that reporting window where we had time to close off the previous year stuff, and then we were ready to report. So we had a nice 6 weeks transition to make sure everyone gets up, but it was really just one day, okay, start doing it. So, yeah.
I find that, a lot of the success in that implementation and the ongoing piece is how much on the vendor side or on the technology side, there's that, you feel very much in this together. You know what I mean? Like when
Very
it goes,
much
like,
so.
we're all hands on and we're all in now.
Yeah.
Was that the case with this one?
Oh, absolutely. Absolutely. We were having, weekly, daily meetings, Teams channels going all the time, just being able to do that, catch up on quick questions and plan going forward and all that sort of stuff. But it really was very, very collaborative. Again, though, it's one of the challenges, I think, with a lot of implementations is making sure the business side has people that understand the technical aspects as well as the business aspects. And sometimes you get clinicians that go, hey, but I need to be able to write this clinically. And they've got no concept of how that has to happen from a technical point of view. So to be fair, it probably went pretty smoothly, because we had a project team of 4 to do this. Okay. And of that, 3 of us had very strong technical backgrounds.
Yeah. Having those translators in the middle, translators, so to speak, to be able to, because you need that understanding. And there's got to be a reason why the clinician says, well, this isn't going to work for me, but you also don't need to raise their hands and set it all on fire. It's, with that problem solving and iteration as you go is going to be super important. Love to get a vision for like what not the end state, but I guess you build those foundations and you kind of get settled in, and then where does it go to from here?
Yeah, so it's actually quite interesting. What's happened with the way that we've put the software in and the design of it is we're able to configure extra services ourselves. We don't have to keep coming back to the vendor to say, oh, now we want to put these guys on, now we want to do this. So what happened very quickly after we'd implemented it, we had a couple of extra services that, again, were reporting everything on Excel spreadsheet, wasn't being counted appropriately. They came to us and said, oh, we've heard about this system, can we use it? So we were able to roll it out to our renal telehealth team. To do things there, and the allergy testing service as well. They were a couple of nurses sitting in offices making phone calls all day that we weren't counting as activity.
Yeah.
They were doing the jobs and they were doing a fantastic job, but being able to book it into a system where we could then report from, again, where we were maximising our funding. So there's a lot of those little services all through.
I feel like that point is super powerful for a number of reasons to the one you just outlined, but also when you're trying to justify or determine the return on investment of a particular solution, or like the efficiency and how we're going, if it's not what gets measured gets managed, and that whole kind of mantra is important. And I find sometimes with these implementations where all of a sudden now we can see the time frame between A and B, and so now we can determine if and not for like staff punitive reasons or anything like this, but it's a real if we can start to hone in on improving things, that means better use of existing people and assets, but hopefully better outcomes for patients too. So.
Absolutely. The key thing that we found, particularly in the community health space, where we have patients that might move between a couple of different teams to a couple of different services, they suddenly had visibility right across. They could sort of say, oh, they're already in with the chronic pain service and now we're doing their wound management, or we've got post-acute care going on for them. They could see it all, and it was really good. The other real benefit that we had as well is we were able to connect this system to our major EMR. So when we have community mental health patients turning up to ED, the ED clinicians beforehand had no idea. So they would just carry on and they would probably undo all their meds that had been months. They'd probably undo their supports, all that sort of stuff. Yeah. So now they can actually see that these patients are engaged with the community mental health services as well, that's a big, big win.
That's what we need. And then lastly, I guess, is there any, because we talked a bit about what implementation looks like on the clinician side and on the health system side. From a vendor perspective, a good amount of if someone in the audience was looking to create solutions for health systems or looking to say, oh, look, our technology can help address this issue. What advice would you give for those that are creating solutions to improve things in healthcare that would allow them the best chance of success?
I can do a big self-interest, please. You need a health information manager on staff. Yeah. You really do. Only because they've got that insight into what the businesses or your potential clients are going to be looking for, or what problems they need to solve that they might not be able to articulate, particularly when it comes to data and reporting and all those sort of things. But it is really a case of it has to be collaboration all the way, really close collaboration, because and to tease out those answers that the business might not be coming up with themselves because they don't understand the depth.
Yeah. You're speaking my language there 100%. So look, Claire, I really appreciate you making the time to spend some time here at the Data Capture Experts booth, and we'll put the details in the show notes of this episode, and there'll be some more information about DCE there too. So Claire, I really appreciate you making the time.
You're welcome.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe, and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.